Hello, good afternoon. My name is Dr. Chudi of Snowspirations Global Health Solutions. Thank you and welcome to our clinic. Today, today we're going to look at long cycle. What can long cycle tell about your fertility and your pregnancy chances? So our clinic is Snowspirations Global Health Clinic. And every Saturday about this time, we normally run about 30 minutes clinic. So once you join, please introduce yourself. Let's know who you are. Let's know where you're located. Then I'm going to give my presentation, after which you will have opportunity to get feedbacks. It's important to prioritize today's topic. It's going to be important. So today we're going to look at long cycle, long menstrual cycle. What can long menstrual cycle tell us about your fertility? About your possibility of still achieving pregnancy, especially if you are above 35. And we're not going to waste time. I'm going to start. So once you come in, you join me. You see, when your cycle goes beyond 35 days, it's considered long. Remember that your cycle is the number of days between your bleeding days. So your cycle is the number of days from January to February when you bled. So if you bled on 1st January and you bled on 1st February, your cycle is likely 30 days. So if you bleed every 30 days, your regular cycle. Now, the regular cycle can have a lower limit and an upper limit of normal. The lower limit of normal is 21 days. The upper limit of normal is 35 days. So any woman that bleeds regularly should have about 21 to 35 days. The moment you are now bleeding more than 35 days, it's considered long cycle. Now the question is, what's the implication of having a long cycle? Do you still have fertility window about this time? Can you still ovulate? So that's the major question. Unfortunately, a majority of women that have long cycle, the problem is lack of ovulation or irregular ovulation. That's a very big fertility implication because for you to become pregnant, you have to have ovulation perfectly okay. Without ovulation, you will not become pregnant because ovulation simply means releasing that egg that the sperm will fertilize, so you become pregnant. So majority of women that have cycle length of more than 35 days likely have ovulatory problems. Either you are not ovulating at all, which we call anovulation, or you have oligo-ovulation. Now, this is something you need to be conversant with, especially if you are older than 35. So the possibility you will notice a longer cycle, it's there when you tend towards menopause. Women that are below 35 will likely have a regular or short cycle. The moment you begin to go to the extremes in your reproductive phase of life. So if you have a daughter that recently started bleeding, possibility she can have a long cycle is there. Possibility she can have a short cycle is there. But once you're within the middle point of your reproductive cycle, that's where regularity can actually happen. So it's more important to understand that if you are 35 years and above and you're still believing God to become a mother and pregnancy is not happening and you have a cycle length of about 40 or 50, we have a problem. We have to quickly confirm that you are still ovulating. So one of the cardinal things we have to do for you is to go for day 21 progesterone. Day 21 progesterone is an important test we normally use in confirming if you are ovulating or not. So in a nutshell, long cycle most times are caused by lack of ovulation or irregular ovulation. Now remember what happens during normal cycle if everything is perfect. The reason why women bleed in their cycle is because of reduction in progesterone. Remember, when pregnancy happens and the fertilized egg is getting ready to implant in the womb, progesterone and estrogen will start going up. The reason why they are going up is to prepare the endometrium for further implantation. So like a building. So pregnancy will happen in the tube, but they will develop in the cover of your womb, which is called the endometrium. So once pregnancy has happened, the whole hormonal pathway will start changing. You will no longer bleed. The reason why you're not bleeding is because progesterone and estrogen is produced at an accelerated rate to make sure that the thickness of your endometrium is covered. Now, when pregnancy fails, when you are not pregnant, or for some reason that fertilized embryo did not implant, the level of progesterone will drop. Once progesterone begins to drop, you will bleed. The reason why you're bleeding is indicative of failed pregnancy if you're within your reproductive phase of life. So if you are bleeding and you are young and you still ovulate, is a sign that pregnancy failed. So women are structured and programmed to become pregnant every month if you are within the younger reproductive phase of your life. So the bleeding you will experience normally, if everything is perfect, is because progesterone is reducing. Now, when you don't ovulate or you didn't produce the follicle, there will be no release of progesterone. And if there is no release of progesterone, there will not be any pattern that will tell us if you are ovulating or not. So if follicle does not mature and you don't ovulate, progesterone level will never, go up on that. It will just be stable. And the lining of your womb will continue to build up as a response to estrogen. Now, eventually, when you bleed in that longer period, so majority of women that will have extended longer period will bleed in heavy clothes. They will bleed on an extended basis. So instead of normal 7 days, some can bleed for 8 days, some can bleed for 9 days, some can bleed for 2 weeks. That's abnormal bleeding. And some will bleed in clot because that's not the normal pattern. So your take home this afternoon, when you notice you are no longer within your predictive phase of your cycle, please go and retain the services of a fertility specialist, especially if you are 35 years and above. It's abnormal. If you notice this pattern for 3 months, you are below 35, but you've noticed that suddenly your cycle changed. Let me give you an example. All your life as a woman, you've always had 24, 25-day cycle, 27, 28-day cycle. Then suddenly you are having 45, 50, 60-day cycle. Of course, it's a problem. So I want you to use 3 months to track your cycle. If your cycle for 3 consecutive months is veering off on the higher scale, that's 35 and above, 3 consecutive months, the possibility your fertility is reducing is very high. So we have to run your whole hormonal profile, definitely run your ovarian reserve test, definitely run your day 21 progesterone, run your estrogen, run your FSH, run your LH to make sure that everything is okay. Now, what is the major reason? What is the major cause of having long bleeding, long cycle? The biggest player in leading to long cycle is polycystic ovarian syndrome. There are a couple of other major causes that can lead to this, but polycystic ovarian syndrome will lead to what we call oligo-ovulation. Oligo-ovulation means reduction in ovulation. So we have 12 calendar months every year. In women that have oligo-ovulation, expectedly, you are supposed to, worst case scenario, ovulate for 9 months out of the 12 months. But women that have oligo-ovulation might actually ovulate for just 3 months out of the 12, or 2 months, or 4, which is a problem because you can't really pinpoint when you should go and start preparing for pregnancy. So polycystic ovarian syndrome, it's one of the biggest players in women that have long cycle, long bleeding that will eventually come with clot. So if you have polycystic ovarian syndrome, the major problem in polycystic ovarian syndrome is hormone imbalance. In women that have polycystic ovarian syndrome, they have multiple eggs, which are polymatured eggs in multiple follicles. That's why it's called cystic. Poly means many. So when you go to the ovaries, they will not have the normal architecture. Now, it's because in these women, instead of having normal level of estrogen, they have lower level of estrogen, but more androgens, things like testosterone. Now, androgens are male predominated hormones. So I have a lot of androgens now. I have a lot of testosterone because I'm a man. Women should have testosterone, but not at the level that will be higher than progesterone. So that will be higher than estrogen. So the problem in polycystic ovarian syndrome is lack of ovulation, because you have a preponderance of androgens, which is the male hormone. And when that happens, your whole body will not perform their role as a woman. So one of the cardinal treatments of polycystic ovarian syndrome is to place you on fertility drug, which will go and induce your ovaries to produce eggs. So ovulation induction drugs like Clomid. Then we give you metformin, which is a drug we normally use in managing diabetes because of insulin resistance. So that's the hallmark of long cycles. So thankfully, women that have polycystic ovarian syndrome, if you follow professional advice, we can balance your hormone. We can work on your body weight. We can control your insulin problem. Then you can become pregnant. So the fact you have polycystic ovarian syndrome doesn't mean you can become pregnant. But we must make sure we follow it in a very good approach so that we can help you. Now, women that have thyroid hormone problems, so if you have hyperthyroidism or if you have hypothyroidism, you can also present with long duration of your cycle, long bleeding. Now, if you also have elevation in your prolactin level, hyperprolactinemia, it can also lead to long period, long cycle that will mean your fertility is dwindling. If you recently added a lot of body weight and your BMI is tending towards 30, that can also lead to long period, long cycle. If you recently lost a lot of body weight, probably you're anorexic or you had some problem that messed up your body, that can also lead to long period that will now eventually come with a lot of knots. So these are important things you should be conversant with your cycle. Now, how do you know if your cycle is long or short? Like I normally teach you guys, go and get a plain paper. In your plain paper, list January to December. When you list January to December, each month, mark the first day you bled. Mark the last day you bled. Count the number of days between the first day you bled and the last day you bled. So long as you're bleeding up to 2 days and you're not exceeding 7 days, that's your normal. So if you go to January, you mark your first day, you mark your last day, February, first, last, up to December. Now you begin to count the number of days between months. So count the number of days between January and February. Count the number of days between February and March. Count the number of months between March and April. It will give you your pattern. If you notice that your period now comes after 40 days, that's a long cycle. We don't want that. That's abnormal. If you notice that your period comes after 15 days, that's a short cycle. We don't want that. We want your period to be coming every 21 days or up to every 35 days. That's the normal. When you notice a problem with irregularity, then you can begin to seek help. So the earlier you seek help, the better you can get solutions. Now, long-term problems from long cycle, long duration of bleeding, it's not something you can do by yourself. You need to establish with a fertility specialist as soon as possible so we can get appropriate diagnosis and start managing you immediately. That's my presentation, and I'm going to sit back and start taking your questions. Remember, immediately after this presentation, we're going to go to Facebook. We're going to spend another 30 minutes. We have a big event coming up on the 28th of this month. Mega masterclass on IVF, IUI, and surrogacy. But right now, the clinic is going to open. Please start asking your questions. COO, thank you so much. Tosi, thank you. And Tammy, too sweet. Thank you, guys. And we have other 7 people in the clinic. Please start asking your questions. The clinic is open for questions now. Ask your questions. Feel free and ask your questions. COO, you can lead and just generate some questions and we can use it to teach. Tosi, you can also ask your questions. I know you don't have a need, but feel free and ask your questions. All the people currently in the clinic, is your opportunity to ask questions. When you participate in our clinic, we encourage you to ask questions. That's the fastest way to learn. Ask your questions. Very good question. Of course, I know Kene is going to ask a very significant question. So here's the deal. There are different classifications of fibroid. The importance of fibroid relates to the size of a fibroid, the location of a fibroid, and the symptoms of a fibroid. Now, if you have significantly big fibroid, which is occupying space in your womb, two types, intramural fibroid and submucosal fibroid, bigger than 5 cm, tending to 6 cm. Possibility they would disrupt the normal architecture of your womb is very high. So majority of women that have intramural fibroid, submucosal fibroid, bigger than 5 cm will experience thick, prolonged bleeding. That's a hallmark. And most times, painful bleeding, painful lovemaking, painful defecation, painful urination, swollen belly from fibroid. That fibroid can also, to an extent, lead to long cycle. But it's not common now to have long cycle in fibroid. What we normally experience is when you eventually want to bleed, you will bleed heavily and it will come in clot and it will come with dysmenorrhea, which is painful bleeding. So fibroid is a big player in your period, in your cycle, in your fertility. If you have fertility impactful fibroid, then we need to remove it. So all the fibroids inside your womb, bigger than 5 cm, likely needs to be removed through myomectomy because they can affect your fertility. And if you eventually become pregnant and that particular fibroid is symptomatic, they can also lead to miscarriage. So you have to go and make sure you have due consultation for your fibroid, know the type of fibroid you have, know the size, know the location, they know your symptoms, and ultimately, if you have to remove it, you remove it. I love that question. What causes waist pain 3 days before period? So if this is your constant, then what you likely have is what we call PMS, premenstrual syndrome. Now, when you are about to have your period, your body begins to change, redistribution of a couple of hormones. There's a particular type of substance we call prostaglandin, which is elevated when you're about to bleed. That's what actually leads to the pain you might likely be having. But if this is your constant and it happens a few days after your period, then after that you're okay, then what you have is premenstrual syndrome, completely okay. Personally, I'm not an advocate of popping painkillers, so try and find a way you can manage this pain, and once your period is done, you'll be fine. I'm not worried about that. Does low progesterone cause miscarriage? 100%. The reason why progesterone is very important in pregnancy is because together with estrogen, both of them are responsible for maintaining your pregnancy. But more importantly, your progesterone. Progesterone is the pregnancy maintaining, nourishing hormone. Progesterone together with estrogen will make sure you have adequate thickness in the endometrium. If your progesterone is low, pregnancy might happen, but you have miscarriage, or you will not even have pregnancy happen at all. So yes, progesterone is very, very important in preventing miscarriage. Irregular period for nursing mom. It's expected that a nursing mom will have irregular period. The reason is because shortly after giving birth, with high level of prolactin, definitely is going to disrupt all your hormones. So especially women that are giving exclusive breastfeeding, you will take a longer time for your period to come back. So irregularity shortly after birth is expected because after birth, especially when you have a high level of prolactin, prolactin is the hormone that leads to milk letdown that will aid you to breastfeed your baby. When you're a new mother, the level is very high and it will affect your estrogen, progesterone, FSH, LH, thyroid hormones, and you will have irregularity. Completely fine. That's no problem. Does seedlings fibroid grow through pregnancy? Most times, 99.9% of times, the only fibroid that will grow big in pregnancy are the fibroid you already had before the pregnancy. It's very rare for women to develop new fibroid during pregnancy. So you have this fibroid, either you didn't want to go remove it or you don't have a good doctor. Because for all the women that want to conceive, we want to run all your profile properly. So if we run an ultrasound and we discover you have fibroid and we feel the fibroid will be impactful in your pregnancy, then we remove it. So you don't normally develop new fibroids in pregnancy. It's the fibroids you had before pregnancy that became big. Because during pregnancy, the same hormones that will nourish your baby and the same blood supply will nourish the fibroid and they will have a tendency of getting big. Okay? All right. If you have more questions, please ask. If not, we're going to transition to Facebook immediately. Beautiful questions from you guys. Remember to follow this particular YouTube channel. Subscribe, place your notification correctly so that anytime I come live, you will know I came live. Now, Tuesdays, 6:30 p.m. Eastern Time, US, 11:30 p.m. Nigerian time. You will find me here. Saturdays about this time. So those are 2 times in the week. You gain a lot of insight. You understand your body better. You improve your fertility. And ultimately, you become a mother. Okay? All right. So thank you for coming. Please join me in Facebook immediately. And we continue the conversation about long menstrual cycle and your fertility and your possibility of becoming pregnant. Thank you guys so much. COO, thank you. And I'll see you guys in Facebook right now. God bless.